So thank you very much for being here, for inviting me, and thank you to Raj for inviting me to come to this event. It is great actually to see it happening, and it's great that we've got something that is dedicated to clinical informatics, clinical data, and clinicians that are so keen to really use that information, that data, and to lead the way. Before I start, I'm just going to come out here so I can see better. How many of you in the room are doctors? Cool. How many are AHPs of some description? And how many nurses have we got? Okay, cool. That's about the average, I thought. So for those of you that aren't nurses, as the Chief Nursing Officer for England, you will know I will actually talk a bit about nursing, so apologies for that. But I'm hoping that what I talk about will also be interesting to clinicians of whatever type and whatever your background. The other thing is I'm not an IT or a technical expert by any shape or form. So those of you that know me will know that that is true. But that doesn't matter, because the important thing is about how we promote and use data, technology, information. And I think that's what's so vital, and that's why I was so pleased to be invited. So some of you will know this, but I'm guessing that quite a lot in the audience won't, that in May last year, I launched Leading Change, Adding Value. So that is the framework for nursing, midwifery and care staff that we've developed with thousands of people. We've asked nurses, midwives, care staff and patients what was important to them. We looked at the 5-year forward view. We looked at what the world was doing. We actually decided that we really wanted to put a framework around the over 550,000 nurses and midwives that actually are in England. It's a huge number, and if you think about the impact that all of those individual people can have, both as individuals but also together, so we talk about the power of one, the power of many, there's a real opportunity for nurses, midwives, care staff and all clinicians to really drive the change we want to see. And sometimes I think it's quite frustrating. I spent a lot of time talking to people. I go out and about, I visit hospitals, I visit communities, I visit practices. And what I often hear is people that get quite frustrated with and hugely challenged, and it's massive pressure out in the system. I completely understand and accept that. But people actually don't always feel that they've got the ability to make those changes. And one of the things that I think is so powerful about clinical roles is we can. You can, we can. And as Martin said, there is something about us really driving that change and actually delivering what we think is important for the people that we care for and the public that we care for. So Leading Change, Adding Value is directly linked to the 5-year forward view. And it's specifically looking at how we can reduce the gaps that were identified in that 5-year forward view around health and well-being, care and quality, and also funding and efficiency. And it's central to that is reducing unwarranted variation. And as a result of that, we've got technology running throughout the document. And when I go to the next slide, a specific commitment around it. And when we launched this in May last year, there was a big difference from the previous strategy that I'd launched, which was done in 2012, when I stood on a platform like this with about 400 senior nurses, and I launched Compassion in Practice. This time, I was in a small room in London. The room was packed. It was filmed, and it was live web streamed out to over 2,000 sites, both across England, but also internationally. We had live questioning coming in from around the country, including questions from Australia on what we were doing. And so we actually were able to access a lot more people and in hospitals and communities. They brought people together in rooms. It was a bit daunting talking to a camera, knowing that I was being displayed on screens all over the country, but it actually had an impact, and we got to more people. So that to me was a big change for me in terms of how I worked. You won't be able to read these, but there are 10 commitments that underpin the framework. And the idea about those commitments is we wanted to really identify the things that were important to nurses, midwives and our patients. And they are grouped in a sense. So there's about 3 that look at population health and prevention, really picking up the importance of that specific area of need. There's one that talks about how we work with people, how we engage with patients, carers, families in a very different way, not the paternalistic, maternal type approach that we have in the past used, but much more in collaboration with people that we work with and we care for. There are key commitments there around staffing, making sure we've got the right number of staff, or trying very hard. All of you will be aware of some of the difficulties that we have at the moment with that, but also listening to what staff say. So using your data, your information to understand what staff say is important to them is one of the best opportunities to make improvements in patient care. If you've got staff that feel listened to, empowered, content, even though they may be under significant pressure, we know that there is a very clear impact on patient outcomes and patient experience, very, very clear correlation between the two. And specifically in there is a commitment on the use of technology, and it says, it's commitment 10, and it says we will champion the use of technology and informatics to improve practice, address unwarranted variation and enhance outcomes. Really, really important. And Anne Cooper, who's speaking later, has been engaged and involved in us in both in developing this and helping us to implement that commitment. So at the moment, we've got an increasing number of clinical information officers across England. When I did this, I did a talk similar to this a while ago. We had about 50. We've now got a lot more than that, multi-professional. And actually having people with that level of expertise, that knowledge and the ability to drive and explain and to talk to people in their organisations about the importance of clinical informatics is really, really key. And I'm going to talk a bit later about a presentation that we had at my summit when people talked about what was important to them. I've also got a short video or short film later which just talks about how some midwives in West Sussex have actually used social media and technology differently to engage with their pregnant women. So that was my leading change. That was my addressing unwarranted variation one. So where are we in terms of the leadership challenges that we've got? Quite often when you talk to people that maybe haven't been as used to using digital or technology, it is actually quite daunting. And I remember talking to a chief nurse who was part of the panel and presentation we had at my summit, and she said, I didn't think I knew anything about this. I didn't think I was able or capable of being able to lead this in my organisation. And I think for those of us that are in the I'm a baby boomer generation, when you look at some of the people that are now coming through medical school, universities, it's a very different world. If I need my iPad sorted, I stand more chance of asking Raj's 5-year-old to do it than I do actually trying to sort it myself. So there are things that we are in a very different world than we used to. So the pace of change will continue to increase. Directors of nursing, lead nurses really do need to have digital transformation wherewithal, and if they don't know, not be afraid to ask. We know that we need to have really good nursing and other clinical experts in technology, in science, trying to really drive and increase that amount. And we also need to be very aware that our patients will be much more empowered, that they will come to your surgery, they will come to your consulting room, they will go into your organisations, and they will ask questions, and they will look, and they will search, and they will have information, and they will feel they want to be involved. And for some people, that's quite daunting. For others, it's a real opportunity. So last year, we held a jointly facilitated workshop. So it was led by NHS England and Health Education England, and we also had NHS Digital as a key partner in that. And we asked a variety of different questions about how can we make Commitment 10 real? What can we do to really make it real? And we had some organisations in the room. We had Imperial Healthcare, we had Frimley Healthcare, interestingly both acute trusts. And I know later Jo Rafferty's talking about the importance of data and information in mental health services. And we do still, I think, too often relate more quickly to an acute environment than we do necessarily to primary care or to mental health or to learning disability and to other areas or community. So I think there's something that as clinicians we need to really drive that change in those areas. So attendees considered all of the areas that we've identified on this slide, and actually as a result of that we've got some really great work now with NHS Digital about how we produce it, and Anne is leading the Building a Digital Ready Workforce programme together with colleagues in HEE. So I think that will really help us. So how do we build a digital ready workforce? For nursing and midwifery, or nursing, we have just published, or the NMC have just published new standards for undergraduate education for nurses, and they're about to do the same. They're in the process of looking at midwives as well. How can we build into undergraduate education the need to become, or the ability to become a really good digital ready workforce? What do we need to do to engage in that? How can we ensure that clinical experts in this field are actually out there through talking to students, talking to undergraduate students across their clinical placements about the importance of digital technology and data? Really, really key to do. So let's have a think about some of our roles. So the importance of data is really key. And although I don't do it all the time, I think using data to improve service provision and service delivery is absolutely critical. It really does help us challenge. So if you're looking at unwarranted variation, you need to ask the questions. So, what needs to change? How do we know? How can we look at variation? So what needs to change? And then how do we change it? So if we've got data and we've got information and we can show that variation, it will really give us a pointer of how we can improve care. And the result of that will be improved outcomes, improved experiences, both for our staff and our patients, but also much better use of the resources that we've got available. So the right care work, you're probably all aware of, I would imagine. And the importance of that is really looking at how what variation there is across the country, and how we can look at best practice. It's a bit like the GIRFT programme, getting it right first time. Really, really reducing some of that difference that you can't justify by geography or demographics or the type of severity of illness that a particular person's got. And the very, on one level, would look like quite a simple example. But Betty's story is about leg ulcers. So just to get a bit of interaction here, anybody in the room know how much we spend on managing wounds and the associated comorbidities? Any idea? Give me a figure. God, you're half. Did you all go to the patient safety conference dinner last night?
5.6 billion.
Well done. It's funny now that you know that you've seen my slides. Yes, it's actually 5.3 billion, so pretty close. So 5.3 billion pounds a year. So we reckon we've got about 2.2 million people across the UK that have got a wound. About 30% of these have no diagnosis on their GP record around what's wrong. And we know that leg ulcers is the biggest one. So if we concentrate on the best way of treating those wounds, and there is clear evidence that using that can improve outcomes, can increase healing, can reduce cost, and actually will improve the experience for people. All of us, particularly those of us that have worked in places like A&E or in clinical care or in GP surgeries or community care, will know how distressing leg ulcers, for example, can be. So one example that we ought to do more work on. I think digital leaders need to be all over the SDPs. SDPs are, as you all know, being set up, 44 around the country. It's bringing people together to look at how services can be provided for the population that they serve. They're in different stages of development, but I think we've got a really great opportunity to shape them and influence them. And actually having digital leaders, people that really talk about how you can join up data, you can join up information, you can share, you can work together, actually will have a big impact. So I continually say to nurses and midwives, get out there, knock the doors down, say you want to be involved. To be honest, there are more GPs, there are more doctors involved in STPs, and that's fine because there's clinicians involved. But for those of you that are nurses, I would say get out there and get stuck in and do the same. And the 5-year forward view has clear expectations about what we should do. So it talks about helping people manage their own health, using data and information to do that. It talks about digitising hospitals, really key again. It talks about making sure we've got better use of technology across elective care, urgent and emergency care. and about the digital contribution to research. So some really key areas that we as clinicians can drive and lead the way. So I think leveraging that technology and innovation, supporting individuals to take an active role in their own health, while at the same time enabling NHS staff and colleagues to do their jobs in the best possible way, reducing wasted time, is a really key way of working. So I'm just going to go on and talk a little bit about leadership and technology. So I mentioned earlier that I have well, I didn't mention this. I mentioned I had my annual summit. And so last March, just gone, we had a conference that we held in Birmingham, 2 days, about 500 nurse leaders, academics, all over the country were there. And this year, we centred our summit on 4 themes of innovation and improvement, leadership excellence, culture, personalisation, and it was all done within the Leading Change Adding Value framework. It's a really good opportunity for senior leaders to come together, and we had a very good, almost strategic approach to some of the key challenges that people were facing, and how we as leaders could come together to really try and push some of those things that we wanted to see. One of the things we did was a session on digital transformation and information, and the particular leadership role of nurses and midwives. And we had a panel of strategic and frontline leaders, and this was where Janice, my colleague who's the Executive Director of Nursing at Imperial, was there. She presented and said, I took on this role in my trust, big trust in London. I really didn't think I could do it. I didn't think I'd have the knowledge or the skill. And she was able to articulate so brilliantly the impact of doing that work and what a difference it had made. And she's got one of the guys that works for her, Jerry Bolger, many of you will know, is a real driving force in clinical informatics. So we also had Deborah El Said, who's the Director of Digital and Multi-Channel Development in NHS England. And we also had James Freed, who's the Chief Information Officer for HEE, on the panel, and it was chaired, as you can see there. So it was a really great discussion, actually, a really, really important discussion, and it talked about the challenges and benefits of delivering the national efforts to uptake the use of digital technology. There was a long debate about how can we really champion nursing and midwifery leadership to take that forward. And it actually talked about the digital agenda from a clinical point of view, from a nursing and clinical point of view. So to those in the audience that maybe hadn't thought about it or hadn't used it or hadn't really thought about what their role could be, it really opened people's eyes, and the feedback we had from that session was absolutely brilliant, really, really important. So I would say do more, and something like today is a really good opportunity to do that. Really, really good opportunity to do that. I also wanted to talk a little bit about general practice nursing leadership. And the reason for that is I think sometimes we talk about nursing and midwifery and we don't always talk about general practice. Sometimes GP nurses or general practice nurses will say to me that they feel sort of a bit lost and abandoned. They don't have the same access. They often work in small teams. Some have obviously work in bigger ones, but most of them work in small teams. They don't have the same access to wider information. They don't often get as much access to conferences like this, but actually they are critical in driving change, and they're critical in helping patients manage their own health, and they are critical in actually using and sharing data across the system. And we've got some great examples on our website of general practice nurses that have looked at reducing unwarranted variation through some of the data that they've got across their practices. So really, really important. I'm about to, so somebody's phone's going off here. Oh, well, it might be yours, Raj. Okay. I'm about to launch a 10-point action plan for general practice nursing, and looking at how we can really enhance that as a career framework, a really important place for people to want to work, and how we can support and develop general practice nurses going forward. So that's coming soon. And when we were at both Anne and I were at the RCN Congress earlier this year, and they launched a programme about every nurse being an e-nurse. Really, really important, recognising the importance that nursing plays in that field. So again, something that we are continuing to drive. I want to talk just briefly about enablement and self-management. So we talk often about supported self-care. Many people in this room, including me, including Anne and others, have got a long-term condition that we actually spend quite a lot of our day-to-day life managing. Many years ago, I would have gone to somebody, I'd have gone, trolled along to the hospital, somebody would have taken my blood, they'd have told me that my diabetes was okay or not okay. The nurse might have told, or the doctor would have told me to change my insulin dose. Now, that's something that I do on a day-to-day basis. And for people like, for others that have got pumps, it's an hour-by-hour basis or even more frequently than that. The ability to self-manage and to look at and to take control of your own long-term condition in your own life is something that we are doing more and more and more. It puts the relationship with clinicians in a very different place. But using data, using technology, it does make a huge difference. So me being able to put my blood sugar testing machine, link it into my laptop, send the results to the nurse practitioner in the hospital who looks at it, and then we have a discussion about what I might need to change, something or other. And most of the time now, I have done for many years, change myself. It's a phenomenal difference, and that's just one long-term condition. And when you think about all the others that people have got, and I'm guessing many people in the audience will have something that they need to self-manage, it's a very, very different approach. So making sure that we really enable patients to use that data, use that technology, looking at telemedicine. I was in Cornwall not long ago. I was also in Bradford last week, where I was talking to and I was talking to a GP from Bristol last week as well, where they are using technology to monitor patients and to have automatic links into clinicians that are able to respond if they see things changing or going off. Some patients self-managing and reporting data through, some others actually relying on something that is maybe attached to the patient's arm that actually is able to monitor their vital signs. I know people with COPD that that manage their own temperatures, their own peak flows, etc., etc. So there is something about really changing that relationship between patients, carers, and clinicians to really support people to look after themselves in the best way. And the vast majority of patients actually want to do that. The Child Protection Information Sharing System, CPIS, is another completely different example of us using technology in a different way. So this is an ongoing NHS-sponsored, working closely with NHS Digital. Between the two of us, we are working very closely on this. And this is an initiative that helps clinicians in unscheduled care to identify vulnerable children. It's really innovative. It's the only one of its kind in the world. And it means that data relating to children who are, including those that are unborn, with a child protection plan, looked after status, are securely transmitted and stored in CPIS on the spine. And it means that it can be flagged when children attend. So whether you got an emergency department, you're some sort of urgent or unscheduled care, it brings together that data, that information, and enables people to check and to understand whether that particular child is vulnerable or more vulnerable, whether they've got a child protection, they're on the child protection plan, or whether they've got they're looked after status children. Really, really important. So we've now got thousands of children with those protection plans that have been uploaded onto CPIS. And it's something that is shared with local authorities. So this is not just the NHS, it's local authorities and the NHS working together to support vulnerable children. It's another safety layer in safeguarding. Absolutely critical. And so we are rolling it out. We want to get it out as quickly as we possibly can. And NHS Digital have been brilliant in helping us to do that and to make that work. So if that just saves one child from an injury or an unfortunate incident, it will be worth it. Absolutely critical. So I've did a quick canter through. I was making sure that I stayed on time, and B, that people, because it's probably quite a long way to get to coffee actually, on the basis of how long it took us to get into this room. So what I wanted to do was just finish with a short film clip. And this is from West Sussex. And it shows how midwives identified an issue they had at their trust with people not wanting to talk very much about their weight. And they used social media and technology to really increase their engagement with women. It had a significant impact on women. It increased the engagement, improved patient experience or women's experience. Just a simple example, but just one of many that we could have shown today about how things can improve. I think it will play.
We found that we had a really good group to support women during their pregnancy with weight management issues. But unfortunately, many of the women didn't attend that group.
Women felt very judged when we were talking about weight in pregnancy. Certainly if traditionally they went to see one of the consultants or one of the doctors talking about the weight, and they used to find that that was a very negative appointment, and they used to feel very judged when they came out of that appointment. So we wanted to turn everything around. One of the things that we did was actually ask ladies that did come to the group what would engage them a little bit more within the group. And one of the things that always came up, you know, everybody always on their phones all the time, was actually Facebook.
As midwives, we realised there were these problems and we couldn't get women to attend.
Our Facebook group was the first Facebook group that was set up within the unit, and there was quite a lot of negotiations that went on.
Since the group's been set up, we've noticed there's been much better attendance. Women are aware of what the groups are about. They interact more, they talk to each other, they've got more confidence, they feel more positive about their pregnancy and the service they're getting and the extra pathway they have for their pregnancy care.
The project's very important in adding value to patient experience. The benefit of the peer support that people get from the weight management Facebook page means that they're able to build up relationships and share experiences which they've reported back to us they've found extremely helpful.
Using social media within this setting has become very positive towards us. It's given us lots of confidence as midwives. We've been able to get the information out to women, and overall the communication between the whole team has improved.
I would say to other midwives and other trusts that actually, you know, this is something that is worth trying. Within the service, the maternity service, our engagement with our local population has significantly increased.
So I just thought that was just an idea, and it's social media, so it's not using some of the data and some of the opportunities that I talked about earlier. But I just wanted to end there to say thank you very much for listening. I hope it was reasonably interesting. And there are some real experts in this room that are able to talk about how they've used data to improve services. So Anne's here, Seamus is in the room, who I used to work with when I was in the Northwest, and he's been somebody that was continually giving us data about emergency care performance, enabling us to change what we were doing. So there's lots of examples, lots of people in this room that are real clinical leaders. So thank you for what you do, and go out and continue to spread the word, and this time next year, let's see this room absolutely full. Thank you very much.
Jane, thank you for keeping us to time. But Jane's going to be staying back for the question time session. But I'm happy to take about 2 or 3 questions if there are any from the audience. So,
if not, you can catch me over coffee.
Absolutely. So, right. Do you want to speak up? There's some mics in the audience here? Okay. I don't see any mics. Okay. Do you want to just speak up loudly and I'll repeat the question?
Hi, I'm Vincent, research fellow at Oxford. Just a question about variation. We're already seeing pockets of variation across the NHS. For example, in my field, chemotherapy, prescribing.
Okay. Just hold it for a second. There's a mic there. Yeah. Good. Thanks.
Hi. Thank you. My name is Vincent. I'm a clinical research fellow at Oxford. We're already seeing pockets of variation with digital, for example, chemotherapy e-prescribing and also GP e-health records. But we're probably still at a point where there's the opportunity to ensure a much more universal dissemination. And whilst these don't necessarily cause any patient kind of inequality issues, it may interfere with the communication across trusts or across systems. And variation in itself, may cause inequality, but also it allows the opportunity for innovation as well. So do you think the priority is to necessarily stamp out variation and therefore allow kind of more standardized dissemination? Or do you think it is the current system where individual trusts will kind of adopt a system and then gradually kind of iron out across different areas? What do you think is more important?
So I think that's a really good question. I think it's a bit, I would say, in the words of Helen Bevan, a bit both and. So I think variation is often fine, and it will drive innovation, and it will drive change. But you have to be able to, I think, you have to be able to explain the variation. You have to understand it. And if variation is there because people aren't following evidence-based practice, they're not doing what people know is the best or the right thing to do, it doesn't mean that you can't develop and innovate. But I do think that it's very hard to justify why some people may get a much poorer care or much poorer outcomes because people don't deliver what they know, what we all know is the right thing to do. But having said that, I do agree that actually looking at variation and then looking at what you can do to change does actually drive innovation. So you need to do a bit of both, I think. It's probably not it's not an and or, I think it's both.
Good, thank you, Jane. Yes, David.
Hi, Jane.
Hello.
I've enjoyed the talk. David Rowlands. I'm going to talk as clinical lead for maternity for the North West Coast Clinical Network. So I was really interested in your Facebook and weight loss. Did it actually achieve that in terms of the ladies who engaged with that Facebook program? Did they actually achieve the end point, which to me, as an obstetrician and a clinician, would be weight loss? I can appreciate it reduced the social isolation, it's less judgmental, but was there actually demonstrable improvement in weight loss?
Yeah, I haven't got the figures with me, but yes, I actually checked that before I put it on because I was shocked for that very reason. So yes, it did, because the women engaged more and because they were able to they worked together to understand that it did have an impact, and it did actually enable people to lose weight over and above what they otherwise would have done.
Thanks.
Great. Thank you, Jane. I know she sort of introduced herself as not being a clinical informatician, but having worked with Jane for many, many years, she's been an ardent support of having a connected clinician frontline, and is a massive supporter on NHS England's board as one of its directors for clinical informatics. So Jane, thank you very much indeed for coming in today.